welcome to the Actual Tech Media EcoCast. My name is Jess, and I am excited to be here with you all today. But before we jump into our content, I have some basic information that I want to cover with you. All right, let's kick off our day here today by taking a quick tour of your audience console. And we're going to start with the questions window. So if you haven't already said hi, there is a whole audience of cool humans out there, so reach out and give a wave to the other members of the Actual Tech Media community. Now, keep in mind that if you do have any technical issues today, a browser refresh is going to fix just about anything. But if those tech gremlins are clinging on today, no problem. Just throw a comment in the question section and our crew will be there to help. We also want this to be an informative webinar for you, so throughout today's EcoCast, we hope you'll get engaged and ask all your burning questions. Not only will we have team members responding to you over a live chat, we will also have a dedicated Q&A session at the end of our presentations. Now, if we don't get to your question during the live webinar today, don't worry, because the awesome experts that we have here with us will be following up after we wrap. All right, next up, there's going to be lots of cool aha moments on the EcoCast today, and if you want to share those with your community, we've made it nice and easy for you. You can use the Twitter button right there on your audience console, and the hashtag for today's EcoCast will be automatically added to your post. All right, our last stop on this guided tour, be sure to check out the Handouts tab for some awesome resources and takeaways from our speakers here today. We have an info pack collection, solution briefs, white papers, data sheets, free trials, ebooks, upcoming webinars, and more. So many great resources, so be sure to go explore. Now, if that wasn't enough fun, we also have some exciting prizes that we'll be giving away throughout today's EcoCast. I'm going to tell you a bit more about those later on, but a few quick reminders for you all. First, you do need to be here live in attendance at the EcoCast in order to qualify to win a prize, and we will follow up with all of you after we wrap. Now, all winners must submit an IRS Form W-9 to Actual Tech Media, and all winners must meet the Actual Tech Media prize terms and conditions. Now, if you don't know what those full T's and C's are, that's fine. We've got the full thing for you. Just head on over to that Handouts tab, click in, scroll down to the bottom, and you'll find them waiting for you there. Now, the absolute most important thing to remember is that we love getting all your insightful questions during these live webinars. In fact, we love it so much that we actually have a special additional prize for all you inquisitive folks out there. So in today's EcoCast, we will be giving away a prize for the best question asked in each of our live sessions. Now, the expert speakers and teams will review all questions asked after we wrap the webinar, which means that even if your question does not get read out in a live session, there is still a chance to win. If you are a lucky winner here today and you would like to donate the value of your prize, we have several wonderful organizations that we partner with. So let us know when we follow up about your big win, and we'll get that rolling for you. Again, we are so happy to have you all here with us live at the EcoCast today, and we want to keep that good feeling going, so let's connect on social media. Reach out and connect with Actual Tech Media on Twitter and on LinkedIn. We have lots of great content, and we always want to hear from you. Now, if you're looking for more awesome content and resources right after we wrap the EcoCast today, be sure to subscribe to the Actual Tech Media channel on YouTube. Another fun way to win a prize and, hey, grow this awesome community is to refer an industry friend or a coworker to the Actual Tech Media webinar series. Now, you'll find a link to do that right in your Handouts tab, and you will also be automatically redirected at the end of the webinar. And both you and your coworker or friend could win a prize, and we hold those drawings every month. So be sure to refer a friend because, it could quite literally be a win-win situation. Next, we have a cool opportunity for all the decision makers out there to get connected with new and emerging tech and innovative vendors. Here's how it works. All you need to do is click on the link in your Handouts tab, fill out a quick application, and the Actual Tech crew will then match you with some vendors that we think you should probably be chatting with based on your needs. There will also be fun opportunities that you get to choose to join in, like surveys, test runs, new solutions, extended demos, and so on. You'll get some chances to win extra prizes, you'll chat with great people, and you'll learn about the hottest new trends in tech. So be sure to apply, or hey, send that link to a decision maker on your team. Now, I want to take a quick minute here to remind you all about one of my favorite resources, and that is ransomware.org. You can find out everything you need to know about ransomware, how to prepare, prevent, and recover. This site is jam-packed with information, helpful tips, checklists, strategic approaches, case studies, everything you need in one place. So wherever you are in your ransomware preparedness journey, there is something for you at ransomware.org. Go check it out and start exploring. All right, I have one more exciting resource I have to tell you about today, and that is the Gorilla Guide Book Club. It's going to give you access to free enterprise IT books authored by top industry experts, so you can stay up to date on trending enterprise technology. And yes, these books will work on your Kindle, your mobile device, and as I said, they are completely free. You can download these awesome resources at gorilla.guide, and there's a link for you in that handouts tab as well. All right, well, we have covered a lot of important things already, and I don't know about you all, but I am excited to dive in. So let's get going. Okay, and jumping right into the good stuff here, because today we are talking about transforming IT in healthcare environments. So I love when we get to have these specific conversations, digging into the complexities and the opportunities within one specific industry. And today is all about you. We are all here today because we want to talk about, learn, and explore the ways that digitization is transforming the environments, the skills, knowledge bases, tools, and strategies within our healthcare world. So we're going to chat with some innovative experts from leading companies like Rubrik and Palo Alto Networks who are here today to share their solutions, their tips, their trends, some best practices for creating, maintaining, protecting, and best of all, charging up your IT environments and hitting those growth and scalability goals that your organization is dreaming of. I'm very excited to be here with you all today to be a part of this conversation with each and every one of you. I hope that you will all get engaged. And speaking of that, I have one last thing to tell you about before we dive into our discussions today, and that is, you guessed it, our prize giveaways. So today on the EcoCast, you could win one of three $300 Amazon gift cards that we will be giving away to 3 lucky winners who are here present and live with us at the EcoCast. And as I mentioned in the housekeeping chat this morning, you can find the full T's and C's linked in that handouts tab. If you have any questions, you'll find them there. And with that last little thing, I think we're ready to rock. Let's dive into our EcoCast. And as you can see, we are starting out with one super cool human and expert today. To kick us off, we will be hearing from the one and only Brian M. Posey, a 21 times Microsoft MVP and commercial astronaut candidate. Brian, thank you so much for being here with us again to kick off this interesting conversation all about healthcare IT environments. I am so excited to hear what you have planned for us, so I will hand things right on over to you. Take it away, Brian.
Hello, greetings, and welcome. I'm Brian Posey, and today I want to spend just a few minutes talking about transforming IT in healthcare environments. So before I get started, I want to give you just a little bit more information about my background. As I said, my name is Brian Posey, and I'm a 21-time Microsoft MVP. And in addition to being a freelance technology author and speaker, I'm also a commercial astronaut candidate. And it's been a long time, but I'm also a former healthcare CIO. So let's go ahead and get started by talking a little bit about digital transformation. I've worked in IT for a really long time, over 30 years. And during that time, one of the things that I've observed is that the IT industry has a really bad habit of adopting semi-meaningless buzzwords. I'm sure you've all heard them. I could give you a million examples. But thankfully, digital transformation isn't one of those. Yes, digital transformation is a buzzword, but it has a very clear meaning. It refers to the practice of using technology to automate and improve manual business processes. So simply put, if you've got something in your organization that is a task that you perform manually, a digital transformation would mean finding a way to apply technology to that particular task. And even if you don't fully automate that task, it's a way of using technology to make the task better or more efficient. So that's what I mean when I refer to digital transformation. So with that in mind, let's go ahead and talk about digital transformation as it relates to the healthcare industry. One of the things that I find most interesting about digital transformation as it relates to healthcare is that the pandemic actually accelerated the healthcare industry's digital transformation. There are a lot of different examples of this, but probably the best example, or at least the one that comes to mind first for me, is telehealth, the practice of using video conferencing and things like that as a way of seeing patients outside of the office. Now, telehealth did exist before the onset of the pandemic, but it was used very sparsely. According to one study, which I've linked to at the bottom of the slide, back in 2019, only about 16% of patients for the healthcare organization that was surveyed were using telehealth services. In 2020, at the height of the pandemic, that number increased to 48%. Now, it's since dropped off a little bit. In 2022, that number was only 33%. But even so, this does point to something very important. It shows that people haven't completely gone back to the way that things were before the pandemic. You still have roughly about a third of patients that are relying on telehealth services, at least in the organization that was surveyed for this particular study. So telehealth has a lot of benefits, but I don't think that this particular chart really tells the full tale. So let's talk about why telehealth is important and how it's been so beneficial to the healthcare IT industry. Back in 2020, at the onset of the pandemic, telehealth was viewed primarily as a tool for limiting exposure. The thinking at the time was that if a patient is able to see a doctor from the comfort of their own home, then they're not coming into the office potentially spreading the disease. But since that time, people have come to realize that there are a lot more lasting benefits to using telehealth. And these benefits are some of the reasons why telehealth is still widely in use today, even though we are arguably post-pandemic. So let's go ahead and talk about some of these benefits. And as I do, one of the things that I want you to keep in mind is that even though I'm focusing on telehealth for the purposes of this slide, these benefits that I'm talking about often apply to various other forms of digital transformation within healthcare. So let's talk about some benefits. One of the big benefits is that doctors are potentially able to see more patients in less time. Because if you think about it, working in a clinical setting where patients are coming into the office, you always have people that are running late, and then that can hold up appointments that are further down the line. Whereas in a digital environment, that's a lot less likely to happen. So the doctor's schedules are optimized, and they may be able to see more patients over the course of a day than they otherwise would be able to. Another benefit is that patients are less likely to have to take time off from work for a consultation. I mean, think about what's involved in going to the doctor. You have to get up, get dressed, shower, all of that sort of thing, and then drive to wherever the doctor's office is, sit around in a waiting room and wait to see the doctor, and then finally see the doctor, take care of business, and then drive back home. So the whole thing, even if your visit is 10 minutes long, is going to occupy a couple of hours of your time. Well, that can be very problematic for those who need to work a job. So in a telehealth environment, someone could conceivably reduce that 2 or 3 hour commitment down to maybe 10 or 15 minutes. That means that the patient is a lot less likely to have to take time off from work. Another benefit to using telehealth is that geographic proximity doesn't matter nearly as much as it used to. Now, from the standpoint of the insurance companies, geographic proximity will probably always matter, at least to some extent. I mean, let's face it, in the United States, the insurance companies really don't like patients seeing doctors in other states. But if you put insurance aside, the issue of geographic proximity really begins to make a lot of sense from the context of telehealth. Because consider my situation for a moment. Where I live, there aren't a lot of doctors. But there's a city about an hour and a half from where I live where there are lots of doctors. So conceivably, if I needed to see a doctor in that city, I could either get in the car and drive for an hour and a half to go see that doctor, or I could fire up a telehealth session and talk to that doctor that I might not otherwise be so inclined to see because of the distance involved in commuting to go to that doctor's office. So geographic proximity doesn't matter nearly as much as it used to from the standpoint of receiving healthcare. And what this really means is that telehealth is going to make it a lot easier for people in underserved communities to receive care that they might not previously have been able to get. So another benefit that was brought about through telehealth is that patients are a lot more likely to seek care when you eliminate the hassles of an in-office visit. Now, I talked about this one a little bit earlier from the standpoint of the amount of time that it takes to go see a doctor as opposed to saving a lot of time using telehealth. But there are other hassles associated with an office visit. Consider, for example, that at the height of the pandemic, I ended up breaking my arm. And I really didn't want to have to go get treatment for that because I didn't want to sit around in a waiting room and end up catching something from somebody who was there with an illness. Ultimately, I did, however, end up getting treatment for that broken arm. But that's an example of one of the hassles of in-person care. Another example was from when I was a teenager. When I was a teenager, I broke my ankle, and I had to make a decision about was I going to drive myself to the doctor with a broken ankle, even though doing so would have been extremely painful, Or was I just going to ignore the broken ankle and stay home and try to treat it myself? Well, telehealth, had it existed back then, would have presented a third option. It would have given me a way of seeing a doctor without having to endure the pain of driving with a broken ankle. The bottom line is that telehealth gives patients options, and it makes them more likely to seek care because you've eliminated some of the hassles that are associated with seeking that care. And then finally, the last benefit on the slide is that when you combine telehealth with other technologies such as remote monitoring, it can make it possible to deliver hospital-level care to a patient who's staying in their home. And that, of course, makes the patient a lot more comfortable than they might otherwise be in a hospital setting. And it also helps to bring down costs, which is something that's beneficial to the patient, and it helps to reduce the hassles associated with dealing with the insurance companies. Now, once again, I've been focusing on telehealth, but remember, telehealth is not the only form of digital transformation. The point that I want to make is that even though I'm focusing on one specific type of digital transformation on this slide, there are similar benefits that can be derived from various other types of digital transformation efforts. So some of the primary barriers to digital transformations include dependency on legacy technology. That's one of the big ones, because if you've got a legacy technology that you're using every single day, it's hard to get rid of that technology. Another issue is regulatory or security concerns, because remember, in a healthcare setting, anytime that you bring in new technology and that technology is going to deal with private health information, then you have to consider HIPAA compliance. There are also costs to consider, things like implementation costs, training costs, maintenance cost, any required subscriptions, and that sort of thing. And then also lack of IT experience with regard to whatever technology it is that you're trying to bring in. So those are some of the more common barriers to digital transformations in healthcare environments. So these are the types of things that healthcare organizations are going to need to figure out how to work around. So with that said, I'm just about out of time. I'm Brian Posey. Thanks for listening.
Well, thank you, Brian. And we now have a question for all of you out there. So what we're wondering is, what is your time frame for adding new or updating existing IT solutions at your company? So obviously we're talking about healthcare environments, IT environments, and there's a lot. That's a big, broad spectrum. So are you kind of thinking that you'd be looking to make some of these changes or enhancements in the near future, or maybe thinking a little bit longer term? So no wrong answer here, just kind of curious where you're all at. And I'm seeing a pretty good spread across the board. You guys are almost, it's some variation of 20% entirely across the board right now. So we have, the answer is yes to all, is what I'm taking away from all of you out there. Great. Okay, well, that's a good place to start. That means there's lots to cover, and that's what we'll get into today. Well, thanks to everyone who answered that poll. I have two more quick questions for you. What we're trying to get an idea for is, we're chatting a lot about digital transformation, and there's still maybe some room for some in-person conversations around this as well. And we're just trying to get an idea where you are all at on that thought process. So I'm going to ask you two questions. The first one here you can see on the screen is, how likely would you be to attend an in-person actual tech media event just like this one if you had to travel to it? So this is if you had to travel, if you had to get in an airplane, if you had to fly somewhere, somewhere tropical, guys. It could be somewhere warm and sunny, somewhere exotic, somewhere with fancy, coffees and villas and piazzas. I jumped from tropical beaches to Europe. I don't know if you noticed that, but wherever we want to go, would you get on a flight and would you go attend an in-person actual tech media event if you had to travel to it? Now, the next question I'm going to ask you is the same thing, but if it was a little more local. So if that changes your answer here, this first one is, would you attend if you had to travel? So hang on to that. Getting a few more answers in. Run back to your computers if you walked away to get coffee. The second question I want to ask you is, how likely would you be to attend a small or mid-size in-person actual tech media event if it was within driving distance? So, we'll pick some major hubs and we would have it across specific areas. And so if it was easy for you to get to, you could just hop in your car and drive over there. Would you then attend? And again, no wrong answers here. This is just us getting an idea. We always want to make sure that we're getting you the information that you need when and how you need it. So if the best possible way is while you're sitting on your couch or at your home office or office, then great. We're going to keep these coming. But if there's an opportunity that we can reach people a little bit more in person, if that's something that you're interested in, we want to make sure that we're aware of that. So this is just no commitments, just kind of checking out where you guys are all at. All right, well, thank you to everyone who took some time to answer that poll. We really appreciate getting your feedback. And again, helps us kind of craft our programming so we make sure that we're getting you what you need. Well, speaking of getting the information you need, we're going to move things along in this EcoCast here because it is time to jump into our very first presentation. It is my pleasure to introduce you to our first two experts in today's EcoCast. And we are definitely starting out with a bang here because we have with us here now Christina Avernova, Principal Product Marketing Manager at Rubrik, and Zubin Talavia, Advisory Sales Engineer also at Rubrik. Christina and Zubin, thank you so much for being here to get us started today. Now I know you have some really exciting content, plus we want to do a demo, which I can't wait to see. So without any further ado, Christina, Zubin, the platform is all yours. Take it away.
Hello, and thank you for coming to our webinar, Protect Your Healthcare Organizations from Ransomware Attacks. It took one email. An employee at the University of Vermont Medical Center clicked on a file in an email from their homeowners association, and that mistake has led to a series of unfortunate events. The hospital became a victim of a cyber attack. The rest of the hospitals within that network also became victims, including one of the largest hospitals in the state in Burlington. Very, very sad situation because of that attack, the hospitals were not able to perform surgeries. They had to postpone care and treatments, including treatments to cancer patients. Hello from me. My name is Christina Avernova. I am on the product marketing team here at Rubrik, and joining me today is Zubin Talavia, an advisory sales engineer at Rubrik. Today, we would like to talk to you about what we see in healthcare, what is happening in the industry. We will then introduce Rubrik Security Cloud, and we'll show you a live demo of Rubrik Security Cloud. We would like to then share a few success stories. So what do we see in healthcare? It's all about patient care. When I want to communicate with my doctors, I use the patient portals. It's very convenient for me. I can quickly send an email to my doctor, hey, we need to send a referral for my son's treatment. I can ping any of my doctors, say, hey, this and this is going on. Do I need to see you? Do I need to come see you? Can we perhaps have a telehealth session? Reality is that many healthcare organizations and providers are going through an ongoing transformation of the way they deliver their care to patients, and patient portals, wellness application, myriad of clinical applications, remote patient monitoring. Those are just the things we now expect out of our healthcare providers. At the same time, though, those providers are facing a relentless barrage of cyber attacks. And in fact, 73% of total data breaches in the first half of 2022 targeted healthcare providers. And there are unfortunately many stories than the one we heard at the beginning. And those, as we heard in the story, the implications are painful. Yes, surgeries are postponed and treatments are postponed, and the patient care is interrupted. But there is also another downside. Now those cyber attacks come with a record high price tag, 10 million on average and more. And unfortunately, many healthcare organizations choose to pay the ransom so they can quickly go back to their business, so they can quickly go back to their patients. Some of them know that their recovery can take months and they cannot afford that. So it's just easy to pay the ransom. Reality is that if you want to create trust with your patients in this digital health space, because this transformation will continue, we as patients expect nothing less. You need to prioritize the protection of our data. You need to prioritize protection of patient data, yes. And what I'm going to say is nothing new. You have to protect the electronic healthcare systems, the Epics, the Meditechs, the Cerners of the world. You have to secure the volumes of unstructured data, all these MRIs, PACS images, and so forth. Safeguard, the cloud workloads. And at the same time, you cannot forget about compliance because you operate in a heavily regulated industry. Sensitive data, patient data cannot be left exposed, or not everybody can have access to this type of data. And you need to continuously monitor for those, for ransomware malware. If and when a ransomware attack happens, you should be able to recover fast. And in fact, you should always be ready for any type of a disaster or cyber recovery. The good news is that here at Rubrik, we are your partner and we help you deliver uninterrupted patient care with Rubrik Security Cloud. Let me tell you a little bit more about it. First, I want to tell you how we help you achieve data resilience. Well, it's because we have from design, the product was designed with an immutable file system. That file system comes with an intelligent data lock. So the data is held for more than 7 days beyond the last admin action. We also have a retention log that it needs two people to approve a change in any of the retention policies. So you always know you have plenty of data available for recovery. Access is very much control. We have granular roles-based access, and of course, mandatory and natively enforced MFAs and TLTPs. The product of the Rubrik Security Cloud also gives a logical air gap, so the data is undiscoverable with NFS and SMB network protocols, and encryption is everywhere at rest and in flight. And as I mentioned earlier, it is immutable by design. We have a proprietary append-only file system that does not allow for the data to be changed, deleted, or modified. And with the 3 pillars of Rubrik Security Cloud, data resilience, data observability, and data remediation, we allow you to protect that data wherever it lives, across on-premises, in the cloud, or in SaaS applications. The enterprise data protection will protect your Epic, Medicare, and Cerner EHR systems, as well as many of your databases. You can secure your petabytes of PACS images that live on your NAS devices with NAS Cloud Direct. Better yet, you can discover what type of NAS data you have, where you have it, which one you need to back up, which you need to archive. And the best thing is you can do that with a great performance and scale, and we'll show you about it a little bit later. We also allow you to safeguard your cloud workloads in any of the AWSs or Google Cloud or Azure, and of course protect the critical and popular Microsoft 365 suite of products. Now with data observability, we help you ensure compliance. Data Security Command Center will tell you what is the score of your security posture. How are you able to protect your data? And with threat hunting, you can continuously monitor for ransomware, so you can know if there is a malware hiding in your backups. And sensitive data monitoring will help you meet your HIPAA compliance, because we can tell you if there is some sensitive data, patient data sitting on a folder out there on a server where it shouldn't be. Lastly, with data remediation, if and when there is an attack or a disaster, we can help you orchestrate an inflation recovery very quickly. And with threat containment, we can quarantine the data so we can make sure that when you recover, you are not being reinfected again. But I think I've talked for a while, and I think now it's time for a code demo. So Zubin, take it away.
Thank you, Christina. Thank you for the introduction. So my name is Zubin Talavia. I've been with Rubrik for about 4 years. And what I'm going to do in the next 10 minutes or so is just quickly walk you through the SaaS platform, Rubrik Security Cloud, as it's called, just to quickly show you the features. So what you're seeing right now is the landing page for Rubrik Security Cloud. It's a global dashboard that shows you, the status of your environment, whether it's an on-prem data center, what you're protecting, whether it's in the cloud, with any cloud workloads like AWS, RDS, or GCP workloads, which we can natively protect within the cloud itself. Any SaaS platforms offerings like M365, if you want to back up and restore your Exchange Online or SharePoint or Teams, for example, or in less, we can kind of do that natively from here as well. Now, along with data protection, we can also show you more insightful data about your environment. So if you are being hit by a ransomware attack, we can kind of flag that as an anomaly and can investigate that further. We can also scan your data for sensitive information that you may have in an environment like PII, PCI, HIPAA information. And then we also have the ability to set up application blueprints or recovery blueprints, where you can actually fail over and fail back entire applications from one data center to the other data center. So now just looking at the overall screen, setting up policies, viewing reports is very straightforward. If I want to just go in and see what's my status of my data centers in the US, just clicking on it will take me to the page for those clusters. And I can either click on individual clusters to see that, or I can set up a global policy that will then be used across various clusters. Setting up policy is pretty straightforward. All I need to know is I can choose what data types I maybe want this for, choose the frequency, daily backups maybe for 30 days. And then I can choose whether I want to do archiving. I can choose different archiving locations based on the clusters that I have. Whether it's AWS, Azure, GCP, or our Rubrik Cloud Vault, which is our immutable copy in the cloud, can be used for this as well. And then I can either choose that. I can choose the archive. If I want to replicate the data, give it a name, set the policy. Once I create that policy, I can now easily take that policy and assign it to any objects that I want. I can now see a global view of all the objects in my environment that I have protected, whether it's different hypervisors, different physical or virtual machines, Windows, Linux, different applications, so databases as well. And I can now choose, let's say, for example, I want to protect a couple of VMs, whether by clusters or tags. I can just kind of go in here, choose the virtual machines, click on Manage Protection, choose the policy that I just created, and I'm on my way. Very easy and straightforward to create policies and manage your entire environment from a single pane of glass through the Rubrik Security Cloud. I can also view events globally. I can see reports globally as well. So I can kind of report across entire enterprises or even have it filtered down by a particular cluster or location. And more than that, what I can also do is see what else is going on in my environment. So I can kind of switch views from a data protection view to more of a ransom investigation view. And in there, as we're backing the data, we can scan your backups for any signs of malware. Once we detect that there is something going on in the environment, we can flag that as an anomaly, and you can investigate that. Once we start that process, you can now see very quickly what systems have been impacted, where in those systems the impact is. If I were to click on this file servers, it tells me that, hey, it's kind of a suspect that it's a lockbit kind of encryption going on, you have about, a bunch of files deleted, bunch of files added. So it's, we are fairly confident that there's a ransomware attack happening. And then we can kind of, by one more click, we can find out exactly where the files have been added and deleted. So we can kind of, pinpoint the exact location of the encryption. And then furthermore, we can kind of switch views and actually see what kind of data was in those file systems or in the shares that possibly has been exfiltrated or has been exposed. So you can kind of now see that, for example, in my HR department, I have about 17,000 links or sensitive hits that have been exposed. And I can now go in and kind of see what kind of information was it. So there's a bunch of them were USPII, HIPAA related, UKPII. I can now also kind of investigate further and see, what kind of, what users had access to it, when was it last accessed, who had, and when was it last modified. Gives me a good overview and idea of the blast radius of the attack. I can now switch views, kind of see more from a data security command center view of where I stand in the environment, right? What's my data security score? Now, this is kind of the score depends on features that you have turned on in your environment and also across different industries or different customers within your industry. So you can see that, for example, our ransom investigation sensitivity are all turned on, so I'm good there. But my platform security is not that good. Probably the reason being that I don't have all the users using, multi-factor authentication, which is very important to have. I can also now further notice that from a data protection perspective, I'm not using retention locks. So that's why, I'm at risk of, my data being exposed or data being deleted if someone gets access to my credentials and, reduces the retention. I'm not protecting all the objects in the environment. So that's why I'm at risk over there as well. We are adding more and more insights in the dashboard, and you will notice in the next several weeks, you'll have more and more insightful data that can be gleaned and figure out different ways we can improve your security score and be more protected in the environment. So just to recap, what we have here is a true single pane of glass. That's Rubrik Security Cloud. We not only can protect the data effectively, whether it's on-prem, cloud, SaaS workloads, but along with that data, we can also help you improve your security posture. As you know, Rubrik itself is immutable from a file system perspective, but we have layers of protection on top of that, like a 2% rule, retention lock, single sign-on, which can be turned on, and then we can further blanket that with ransom investigation, which uses AI and machine learning algorithms to figure out if your ransomware attack is going on in an environment, pinpoint the scope of the attack, the blast radius, figure out what kind of data was exposed. And more importantly, once you have all that information, you need to recover that data. Now, recovering that data, you want to recover it to a point in time where you're clean, right? So you don't reinfect yourself. That's where we have threat hunts. We have the ability to run a scan of your backups from the beginning of time, the latest snapshot, using Yara rules, file hashes, or file patterns. And you can kind of choose the cluster you want to protect or you want to scan against. How far back do you want to go? And then once you run the scan and it completes, we can kind of show you a report of where the information is and what kind of threats were detected based on the Yara rule or the file hash, and when it will be safe for you to recover that data. So as you can see here, up to November 8th, anything up to November 8th and after that, you're probably, it's not a good idea because you probably had the malware in the system at that point. Anything before November 8th, you're fine to restore because that does not have the malware. So very quickly, we can kind of help you recover your data to a point in time that's clean, that's safe, and then the risk of reinfection is none. What I'm going to do in the next 5 to 7 minutes is quickly go through a quick demo of NAS Cloud Direct. NAS Cloud Direct is basically meant for petabyte scale NAS unstructured data backup. It's very lightweight because there's no hardware that you need on-prem. All you need is a virtual machine that will then, we can kind of scan your NAS or file shares and ingest the data very quickly using the secret sauce that is in NAS Cloud Direct, and can write to any public or private cloud in the environment. Getting to NAS Cloud Direct, setting up policies and viewing the data is very easy, just like everything else in Rubrik. You can get to NAS Cloud Direct using our Rubrik Security Cloud, which is a SaaS platform. As you can see in the screen here, I have set up a few NAS Cloud Direct virtual machines. I'm going to select the one which says Rubrik NAS NA2. And you can see that there are a bunch of systems have been already added to this particular VM. Now, I can easily add a system quickly by just clicking on this, going through the options here, whether it's Isilon, NetApp cluster, Pure, Cumulo, or if you have some other kind of array or a file system, I can just use generic NFS or SMB. Once I've added that system, and it auto discovers the shares below it, if it's like an Isilon or a NetApp or any of the ones that we have an API for. And then I can kind of quickly go in and see the data. So if I were to go in, for example, and I'm going to the NetApp, I've discovered like, okay, I've got all these different volumes and different servers. I can now, select a particular folder, for example, and then I can either create use an existing policy that I have, or I can kind of create a new policy. And creating a new policy is fairly straightforward here. You just go in, choose whether I want a backup or an archive policy, how often, give it a name, how often do you want to run it, daily, weekly, monthly, where do I want to go, where do I want to put it. So if it's a Microsoft Azure or AWS, for example, I can just choose that. I can choose the bucket, whether it's whether it's something that I already created in the East, West, or any of the regions, and then the tier. So as you can see, we support all kinds of tiers, whether it's Azure or AWS or Google, gold tier, hot tier, or even the archive tier as well. And then how long do I want to keep the data for? Once I create the policy, I have I go into my systems here. I can now choose a particular folder that I want to protect, select the policy that I basically wanted to use for this, and I say apply, and that'll start the process of backing up that folder with the policy and saving it in the location for the retention that I chose. Recovering the data is also fairly straightforward and very easy. As you can see, I have selected this particular share here, or this machine here that has data already in it. I can now see that it's been backed up by a policy that was writing to a daily, keeping it for a month. I can now go in, and if I wanted to restore that policy, or data in that policy, I can kind of quickly go in there and kind of recover the data. So let's click on that. And you can see all the timestamps of all the data that was backed up every day. I want to go to the one that was the latest one, for example, and I can kind of choose, let's say, this particular folder. I can click on restore, choose the system, choose the share, to the path, whether I want to notify any people for person or group for this, and start the restore process. It's as simple and easy as that. And the other thing I can also quickly do with NAS Cloud Direct is the ability to actually run a data discovery portion on the data on my NAS. This is actually pretty cool because even without running a backup or doing a recovery, I can scan my NAS, which are petabytes of data, and I can kind of show you very quickly, what is that state of the data, right? From this particular screen, you can see that I have about 32 terabytes of data on this particular share or NAS that has not been touched for over a year, right? So if that's the case, then why am I backing it up? Why can't I just archive it off and not have to worry about it? Uh, from it from a perspective of restoring the data in case of a DR scenario, you now know that I don't have to recover my 100 or 200 terabytes of data. I just need to recover my 60 terabytes of data because that's the most used or most modified or most like last accessed, right? So if I kind of click on switch to the last access view, I can see that, all right, a bunch of data is being accessed last, so I should recover that, but I don't need to recover some data that is over a year old because I can recover that later. But my main focus should be the data that has been accessed more frequently. So having said that, we also have reports that you can run in an environment that kind of show you, hey, what tasks, what policies, what was going on in the environment. You can search for data within your within all the backups that you've done. You can monitor the policies, activities, kind of see the failures as well, and very quickly troubleshoot any issues that you may have. All this, again, works without a need for any on-prem hardware. All we need is a virtual machine which scales, which is very highly scalable, actually. So a single virtual machine can help ingest between 3 to 5 petabytes of data. So, and at steady state, obviously, I don't think you're going to be having 5 terabytes of data change every day. So, one virtual machine more than covers a vast majority of all customers, and we have larger customers that are ingesting, 12, 15 petabytes of data with just a couple of virtual machines in the environment. So hopefully this gives you a good overview and idea of NAS Cloud Direct and the powerful way it can back up your NAS, your petabyte scale NAS efficiently and effectively. Thank you.
Thank you, Zubin. Now, as promised, I would like to share a few customer success stories we have at Rubrik. We are proud to be protecting the data of over 4,500 customers, and we have customers across any vertical, including, of course, in healthcare. And let me tell you a little bit about UCSF. They were really struggling to protect a lot of their data. They were working with a legacy provider, Commvault. They were not having a good cloud coverage or cloud protection of their cloud workloads. And in general, they had a lot of time dedicated to managing that legacy solution. So with Rubrik, first of all, they were able to see great TCO, but they were able to see 80% of management percent improvement in their management and time savings, and that allowed them to focus on more strategic products. But probably best of all, it's the fact that now their restores went from 4 to 6 hours down to seconds. We have a very similar story with Legacy Health. Again, great improvement in their time management and near zero RTOs, but they were also able to see 50% faster Epic cache restores. So aside from the automation they were able to achieve, and again, the time improvement, they were also absolutely impressed with Rubrik's simplicity, how easy it was to protect all this patient data. And the last example is going to be of Jefferson Hospitals. Again, they use the NAS Cloud Direct solution to protect petabytes of data on their NAS devices. They were very impressed with NAS Data Discover because they didn't really know what type of data they have where. So now with that, they were able to see how the file data was changing, how fast it was changing, where are those changes, so they can have better backup, archival, and retention decisions. Again, with NAS Cloud Direct, you can very quickly move petabytes of data with unparalleled performance, in fact, 10 times better than legacy solutions. And you can send this data to any compatible S3 target, either on premises or in the cloud. And with that, we'd like to thank you for your attention.
All right. Well, a big thank you to Christina and to Zubin for that awesome presentation. Now, I want to point out that I have put a poll question up for you all. Now, we would love to get your feedback on any additional resources that you would like to explore from Rubrik. So we just got some incredible information from Christina, from Zubin. That demo was so exciting. It's so great to see a solution in live action, some great case studies. And that's just scratching the surface. There's lots more to dig into with Rubrik. So let Rubrik know what additional information you would like to get, and they will make sure that you get it sent immediately to you, nice and easy. So click on that poll there. I'm also going to suggest that you head on over to the Handouts tab and be sure to download the data sheet from Rubrik. That's Rubrik for Cloud Native Protection, Automate Backup and Rapid Recovery, that's important, at scale across your hybrid and multi-cloud environments. It is short, it is punchy, it is a super interesting read covering these very specific challenges for backup and creating those rapid recovery strategies at scale across that hybrid and or multi-cloud. So if you're public, private, whatever you've got going on in your environment, there is some information for you in this handout. So be sure you snag that and save to read after we wrap. But for now, while you are downloading that and clicking on the poll, I am going to get into our very first prize giveaway. So we have a $300 Amazon gift card. And a quick reminder that you do need to be here live and present at the EcoCast with us today in order to win. Our very first lucky winner here is Zhonghong Zhu of California. Zhonghong Zhu of California. Congratulations to you, Zhonghong. You have won a $300 Amazon gift card. And as always, we will be in touch about claiming your prize after we wrap the EcoCast today. Now, don't forget, there are still 2 more chances to win an Amazon gift card. Plus, we have that best question gift card from each session. So keep asking those questions because we will be reviewing all questions asked after we wrap. But for now, let's keep zipping right along and jump into our very next presentation on the EcoCast. All right, so today's EcoCast is short and sweet, but boy, does it pack a punch, because here we are at our very last presenter, and it is going to be just jam-packed with cool content and fun takeaways. I am so excited to introduce you all to our very last speaker, our grand finale of the day. We will be chatting with Karthik Tumula, Principal Technical Marketing Engineer at Palo Alto Networks. Karthik, thank you so much for being here with us to close us out, to bring us home on this fascinating conversation we've been engaging in today. I'm very much looking forward to hearing your presentation. I know we're going to do some Q&A with the audience at the end. So without any further ado, Karthik, the platform is all yours. Take it away.
Awesome. Thanks. Hello, everyone. Welcome. So in this particular session, I would like to quickly talk about some of the transformation within the IT and in the healthcare, specifically with Palo Alto's medical IoT security solution, how we can transform IT. So if you look at healthcare industry in particular, we have seen massive digital transformation across the board, right? Mainly with connected clinical devices, where hospitals and healthcare organizations have enhanced patient experience, improved the patient outcomes, as well as reduced the day-to-day cost by adding some very cool clinical devices like what we are seeing, like infusion pumps, diagnostic devices, surgical systems, patient monitoring systems, and things like that. That actually add a lot of business value. But on the flip side, if you look at it, right, we are seeing like this massive amount of connected clinical devices like across the board, but that also adds an expanded attack surface, what we are seeing. And according to the Gartner, we are expecting at least 1.3 billion connected healthcare devices by 2030. That's a 250% increase, and that's massive. And though they are allowing healthcare delivery organizations, hospitals to enhance patient care, on the flip side, we are seeing a lot of attack surface which have been added. Because if you look at clinical devices in particular, oftentimes we see these are kind of considered as weakest links for the attackers, because infusion pumps, oftentimes they ship with unpatched vulnerabilities. And time, healthcare organizations use these infusion pumps, and those devices would be springboards for the attackers. And same goes with imaging systems, like they have like end-of-life OS. And similarly, most of the medical devices traffic is unencrypted. So hence, because of these set of vulnerabilities, we consider the medical IoT devices in particular as weakest links for the attackers. And if you take some examples, we have seen many cyber attacks which happened on the connected clinical devices or medical devices over the course of last 3 to 4 years. And the latest one being the Leon Medical Center in Florida, as well as the Nakona General Hospital in Texas, where hackers have published sensitive patient information as well as the diagnostic information, the images and all into the dark web, right? And this is not just one example. We have seen many examples, and according to the HIPAA journal, like 82% of the healthcare organizations have experienced one or the other cyber attack. So that's massive. And these clinical devices, again, I would like to reemphasize, they provide a lot of business value, enhance patient experience and patient outcomes, but also has devastating effects on the network. And what we can do to protect these, right? If you look at the modern security tools, mainly the security tools what our network security administrators, or for that matter, if you look at the other personas like IML teams or teams engineering teams uses, they are not sufficient. If that is sufficient, then we are not going to see these many attacks over the course of last 3 to 4 or 5 years, right? So some of the key security challenges, if you look at it, one, identifying every clinical device. So you can't go and write a segmentation policy. You can't go and mitigate the threat for the devices which you can't see, right? And two, you also need to provide and understand the vulnerabilities. Like oftentimes we see the vulnerabilities or the risks which are exposed to clinical devices are massive because of this unsupported operating systems, end-of-life OS, and things like that. And the number of threats which we are seeing on these devices outweighs the ability to stop them with the existing security stack. So for the modern security solution, mainly if you want to go with a more of like a zero trust approach to secure these clinical devices, you need complete asset visibility of these clinical devices. And along with that, oftentimes within the healthcare organizations, we also see the office IoT devices like printers, scanners, HVAC systems, and things like that. These are also potential devices which are springboards for the attacker. So we need to protect and provide visibility of every asset. And once we identify that, we also need to create more granular segmentation, which has to be tied to the device context as opposed to like writing this least privilege access policies based on IP address or subnets, right? So that's where we need to provide that clear demarcation, providing the granular segmentation using context. And also, we need to provide more of like a continuous monitoring to do continuous security inspection and threat inspection to block any malwares or attacks which are happening. And also, in terms of the existing or legacy security tools which are being used by the network security administrators, we want to provide more of like a clear, automated, integrated workflows to provide more of like a simplified management for the network security administrators. So that's a modern zero trust security solution looks like. So using Palo Alto's medical IoT security solutions, we can provide a comprehensive zero trust security for all the clinical devices. So how we do that is our ability to provide the complete visibility of every clinical asset. It happens using our machine learning. Like we are not going to do any signature. We are not going to do any agent per se on these clinical devices. We accurately provide classification of all these assets by passively monitoring the network traffic. So with that, we can easily identify what kind of device it is, what is the model number, what is the serial number, the AE tracking information, and the DICOM data, the device utilization statistics, and things like that. So we can provide the complete classification as well as we can assess the risk assessment on every asset. And once we know the risk assessment, we can also go and create more granular segmentation policies using the IOMT device context. So that's how we can massively scale, because here we are leveraging the device context as opposed to IP address. And the medical IoT security, like I mentioned, it uses ML. So since it is ML powered, we can clearly identify if there are any behavior anomalies. And also, along with that, we can also see if there are any known or unknown threats. So we can protect against any zero-day attacks, botnet attacks, SQL injection, command injection, and things like that using our sophisticated threat intel. And also, we can simplify the day-to-day operations of network security administrators as well as the biomed and clinical engineering teams, because we are using the NG firewall as a sensor, as a unified platform for both visibility as well as for policy enforcement. So that way we can massively scale in terms of policies and segmentation. So what are the key steps to secure your IoT lifecycle? So we call it as more of like a closed loop zero trust security because one, we can go and we can identify every asset. And once we identify the every asset, we understand what's the behavior pattern. Like if you take a Philips ultrasound machine, like the ultrasound machine uses DICOM applications, it uses DNS, it uses DHCP. These are the common set of applications what a Philips ultrasound machine uses. So if there is any deviation from its normal baseline, that's where we will elevate the risk score. So that's how we can provide what is a normal behavior versus a normal behavior. So once we understand that, we can provide policy recommendations from the medical IoT portal to the firewall. So it's all automated using few clicks of the button. You can create more granular segmentation policies using the IoT device context, and you can enforce the policy using IoT device context. And after the policies are provisioned, we can also do continuous monitoring to mainly to do trust verification and security inspection so that if there are any threats or sophisticated attacks which are happening on these devices. And once we do that, we can also simplify the day-to-day operations by integrating with your existing security stack like asset management tools like Teams, Novelo, ServiceNow, and things like that, where we can provide integrated software flows for the network security administrators. So in terms of device discovery, like I mentioned, we use machine learning. And apart from machine learning, we can do deep packet inspection with our patented App ID technology with crowdsourced telemetry data to provide accurate classification. So it's more of like a three-tier classification where we put the devices into three different buckets. And apart from providing the device classification for clinical devices especially, we can provide the complete device usage statistics, like how many of these infusion pumps are being utilized, how many of these infusion pumps are seen down on the network. Like we can provide the complete utilization statistics so that the biomed and clinical engineering team can look into these statistics to take like budgetary decisions. And apart from that, we can also do 24/7 monitoring and risk assessment based on the intel what we gather from the threat data as well as from the information what we get from the manufacturer vendors itself. So we can provide more of like a risk assessment on these clinical devices. So this is one good example of how we send the traffic log data from the NG firewall, how we can extract the metadata from the NG firewall and send that information to our IoMT cloud. Because at the end of the day, the IoMT subscription on the NG firewall is a cloud-delivered security subscription. So it's a turnkey. All you need to do is just turn on your NG firewall and send the log data. If our firewall is sitting in line, you can send the log data directly. If your firewall is not sitting in line, you can do span or tap to send them data back to the IoT cloud. So when we do that, we put them into three different buckets by extracting the payloads, the app headers, the DNS response, the IP MAC, and all. And first type of classification is the device category, and second type of classification is based on the vendor make and the model, and the third one is the device instance. So based on this three-tier machine learning model, we classify the device and we put them into these different buckets. So the beauty of this is we can use any of this to identify and create your segmentation policies and also eliminate the risks which are happening on these clinical devices. So apart from identifying the device using machine learning, the other set of capability what the medical IoT security solution provides is the ability to assess the risk. So like I mentioned, we use multi-factor risk assessment. So when I say multi-factor risk assessment, we look into the user practices, like if you're using end-of-life OS, the unpatched operating system, default credentials, as well as we can learn the vulnerability data like CVEs, the FDA recall data, the manufacturer disclosure statement, the EPA CHI information, all these additional set of attributes to identify if there are any anomalies on these clinical devices. So we take all this data into consideration to provide a multi-factor risk. So that risk score is the entity which actually provides like which device is a high-risky device versus which device is like a low-risky device. So once we understand the risk, we can also look into the communication pattern, like what is a normal versus abnormal behavior by identifying the traffic flows. So you can see there is a sample chart on here, like you can clearly understand the device visualization. You can see like based on the subnet, based on the category, based on the device vendor, model and all, and see how individual devices are communicating with each other so that you can go and you can create more granular segmentation policies. Then when we do the segmentation policies, we're actually decoupling the segmentation based on zone, and we are actually creating them using the IoMT device context. Like if you have an infusion pump, like we write the policy based on infusion pump versus like the IP address of infusion pump. And when we do that, we are not just writing static policies here, we are going to automate the complete policy creation framework using our machine learning, because we know what are the common applications these clinical devices uses. So we provide that data in front of the customer so that they can go and they can create those segmentation policies on the fly from the IoMT portal. And also when we do the policy enforcement, it is one-click policy enforcement because we are enforcing it using device IP, which is the policy construct, as opposed to IP address or dynamic address groups. So that's the beauty of this technology. And the main advantage is because you are using dynamic device-based policies, it can massively scale. And also, it can reduce dramatically the policy creation time. Like according to our ESG statistics, we can reduce the policy creation time by 20 times. So that's massive. Like if at all you want to do this exercise manually, you need to go and do that like manually, device by device, understanding the behavior, understanding the applications and all. Like we are going to completely automate the policy creation time. So that's the beauty of this technology. And this is one practical example of how we can reduce the policy creation time. Because on the IoMT portal, like you can see the device, which is the Philips ultrasound machine, and you can understand what is the baseline and what are the applications it is using. So we provide the statistics in front of the customer so that they can go and they can create the policies using a few clicks of a button. And once they do that, they push those onto the NG firewall, and on the NG firewall, you will do the policy enforcement using the device context, which is Philips ultrasound machine in this specific example. So it reduces the policy creation time and also improves the overall policy, because essentially the policy is tied to the device context. So if the device moves, the policy will essentially follow the device. And apart from the policy, the other set of capability, what Palo provides, one of the leaders in the cybersecurity world, we can protect against any known or unknown threats. So like botnets, like SQL ingestion, remote code execution, buffer overflows, because we have our in-depth threat intel using advanced cloud-delivered security subscriptions like threat prevention, wildfire, URL filtering, and all. We have a threat feed so that we can surface all this threat intel data so that we can reduce the attack surface on these clinical devices. And finally, we can also integrate with your existing security stacks, like whether it is network access control tools, vulnerability management tools, asset management tools like Novelo, AIMS, where we can get the IoMT device context information, and also we can share the vulnerability data, threats, alert information back to the other set of security tools so that we can simplify the day-to-day operations of network security administrators. So you can see these are different set of integrations what we support. So it's all playbooks driven, which are thoroughly tested and vetted with our internal team. So you can use any of these integrations to kind of integrate with the existing security stack and also simplify the day-to-day operations. So overall, if you look at medical IoT security, it provides more of like a comprehensive zero trust security to enhance the patient care as well as to improve the patient outcomes. So how we do that is, especially for biomed and clinical engineering teams, we can not only provide the clinical data, but also we provide the utilization statistics so they can enhance the operational experience. And also especially for network security administrators, we provide a complete zero trust security because we not only provide the visibility, but we also assess the risk and we provide the contextual segmentation. So overall, we can provide more of like a closed loop zero trust security for these medical devices. And finally, we can also simplify the compliance according to the NIST and HIPAA guidelines so that your network is always audit ready. So overall, with medical IoT security, we can provide comprehensive zero trust security solutions to protect the clinical devices. So I hope this particular session is informational and helpful to you guys. And please let me know if you guys have any questions. Thank you.
Thank you so much, Karthik. What a great presentation. A wonderful way to bring home our discussion today. And we do have some great questions coming in that I want to dive into. But before we do, I'm just going to point out that I've got a poll up on the screen for all of you. And what we're looking for is what additional information you would like to get about the Palo Alto Network solution. So we obviously just got a lot of great information from Karthik. We are not going to remember it all as much as we want to believe that we will. So an easy way to make sure that you can jog your memory a little bit later is by clicking on the poll right now and letting Palo Alto Networks know how they can follow up with you. So it's essentially clicking the easy button. You're making your future life even easier because Palo Alto is just going to send you exactly what you need, exactly what you're looking for to follow up on that presentation that we just listened to. So please do click on that poll right now. While you're doing that, Karthik and I are going to dive into some questions. You ready?
Yes, absolutely.
Okay. All right, so first question here. How do you go about medical device profiling and policy creation framework for devices?
Yeah, that's a great question. So in terms of medical device profiling, the first thing what we do is we look into the network traffic. We monitor the network traffic, and our AI and ML model will profile the devices and provide 80 different attributes like the model, the serial number, the title, the set of other information like IP, MAC, and all. Like once we identify that, what we do is we understand what are the applications these devices talking to. Like for example, if I take like a DICOM workstation uses DICOM application, it uses DNE, DHCP, SNMP. So these are the common applications which a DICOM workstation uses. So we understand those applications. So we surface the data in the IOMT portal so that the network security administrators can look into the data, and using few clicks of a button, you can go and you can create the policies and you can push them onto the NG firewall. So that's how we can automate the policy creation.
I like that. That's really interesting, actually, and sounds really effective. Second question for you here, and you know what? I'm a big fan. I love talking about zero trust because I think it's a really interesting approach, and obviously gets into so many things that we're talking about. So, question here: what zero trust principles are used in IoT medical security offerings that we're talking about from Palo Alto Networks today?
Yeah, that's a very good question. So in terms of zero trust principles, if you look at it, like holistically from Palo Alto standpoint, we are talking about comprehensive visibility, and then we are talking about least privilege access policies and continuous security inspection and threat prevention, right? Like these are the three main pillars in terms of zero trust security. So with medical IoT security solution, we provide the holistic visibility of all the assets. We're not just talking about clinical devices. We can identify every asset, including the IT assets and Office IoT devices and all. And two, we can assess the risk. Using our continuous security inspection, we can assess the risk of every IoT device, for that matter, like every IoT device. And once we assess the risk, using the principles of zero trust, we can go and we can create these least privilege access policies using the IoMT device content. So that's how we can massively scale, and we can simplify the operations in terms of zero trust.
Okay. We are getting pretty close on time, but I'm just going to try to sneak in one or two more questions for you here, Karthik. How does the IoT product integrate with existing firewalls?
Yeah, that's a very good question. So the beauty of the medical IoT security is it's a cloud subscription. So if you have an existing firewall footprint with Palo Alto, all you need to do is just turn on the IoT subscription, and that's it. You can see the value. It's stuck to the firewall, so it's every time when you turn on IoT subscription on a firewall, automatically you can see not just visibility, but also you can see policy enforcement, which provides a lot of value prop.
Awesome. Okay. I always love when I get to see this question because I do think it's something that a lot of people out there are asking themselves, especially when they're chatting with a few different vendors. Can you give us an idea of what makes Palo Alto Networks solution unique?
Yeah. The main thing where we are unique is we are not just the visibility only solution. We can provide the complete zero trust using the medical IoT security solution, using our unified NG firewall as a platform, because we are not going to put any point sensors out there. We are using our firewalls. So that means we are reducing the total cost of ownership, because there is no additional labor cost, there is no additional infrastructure cost. Anyway, customers would use a firewall. Just turn on the IoT subscription and see the value proposition of providing the visibility as well as contextual segmentation.
Okay. Well, I think that's probably a great place to leave it, although I wish we could keep going, Karthik, because I think there's a lot of interesting stuff to cover here. Before you take off, though, for somebody out there that is really excited and wants to dive in with Palo Alto, and I know there's a lot of folks out there right now that are feeling that way, what do you recommend that they do as their first step?
Yeah, the first step, if you have an existing firewall footprint, we do have a trial license out there for medical IoT security. We have 60-day trial license, so just turn it on and see the value prop of medical IoT security. And two, there are some very good design and deployment guides, as well as the quick start guides out there. And please reach out to us. We are more than happy to start and helping you guys with your Zero Trust journey.
I love that. That's a great way to get started. Always reaching out and chatting with the team, and then really getting their hands on the wheel, getting to kind of take it for a test drive is a great way to see if it's going to work for you. Karthik, thank you so much for being here with us to talk to us today. Thank you for being our grand finale on the EcoCast today. It's been a lot of fun talking to you.
No, absolutely. It's my pleasure. Thank you very much.
And to all of you out there who answered that poll question, keep clicking away. Thank you as well. And be sure that you head on over to the Handouts tab before we take off today. And there's actually a really neat kind of resource center link there under the Palo Alto link. So you can go and explore some of the resources that are specific to healthcare environment cybersecurity needs. So head on over to that Handouts tab right now, open that tab, save that for later, or really quick register, because we're going to wrap things up quickly here. And make sure you get access to all of those resources there, some interesting reads and follow-ups. And while you're all doing that, I know that you are counting along at home and you're saying, hey, Jess, you said 3 gift cards giving away today, and we've only done 1. And you are absolutely right, you smart cookies. So let's go ahead and give away our very last 2 prizes. We've got the 2 Amazon gift cards for $300 each. And those are going to Yana Welton of Colorado, and Brandon Moselli of Texas. So I'm going to repeat all of our winners today. So we had Zhuangheng Zhu of California. We had Yana Welton of Colorado and Brandon Moseley of Texas. Each one of you has won a $300 Amazon gift card. Now, as always, we will follow up with you after we wrap. So we'll send you an email to the email address that you registered on the page here for the webinar, and make sure that you get that response. Now, we are also still looking for that best question asked, that $50 gift card going to the best question asked. So please do make sure that you're getting those questions in, and we're going to be looking at all of them after we wrap and following up with you. So stay tuned. Even if you didn't win, there is still a chance to win that gift card. Well, with that, folks, we are already here at the end of our EcoCast, which means it's time for me to remind you all that if you would like to come and chat with us about presenting on a future summit, an EcoCast, a megacast, or a webinar, we would absolutely love to have that conversation with you. So reach out, shoot us an email at connect@actualtechmedia.com. And you can come have a little chit-chat with myself, with David, with Scott. We would all love to chat with you. All right, and that brings us to an end here. So on behalf of the Actual Tech Media team, I want to thank all of our wonderful speakers that were here with us today from Rubrik and from Palo Alto Networks for making this EcoCast possible. Also, a special thank you to all of you for attending, for asking some great questions. I had a lot of fun with you all today. You know, like I said at the top, I really like getting to dig into some of these more specific opportunities and challenges, especially when we're looking at one specific industry. And today, you know, really digging into that transformation of healthcare and IT environments. There were some really cool opportunities that I think we're all aware of that are out there as we go through this transformation process. And there's also a whole lot of challenges. And that is why it is so great when we get to come together and pool our understanding, pool our experiences, share the information that all of us have together here in one collective place, in one collective conversation. So I hope that you've all gotten some interesting ideas. I hope that you feel maybe a bit more informed, maybe a little more equipped to tackle some of those challenges and start building that IT infrastructure that you've been dreaming about in your organization. And absolutely most of all, I hope that you've had fun with us today. Now, before you take off, I'm going to remind you, speaking of fun, for those of you running out the door to your next meeting, make sure that you have booked or signed up for this Super Summit tomorrow. We're going to be talking about the ransomware spectrum, securing people, technology, and data. This is such a cool conversation. We've got about 6 different presenters, and each one of them it's very short and punchy. So it's sort of these high-level sessions, getting in, or I should say, starting high level and then taking a deep dive really quick and coming right back. But we're really getting a lot of information in a short period of time. So the ransomware spectrum is a great way to get the information that you're thinking about in terms of recovery and protection, backup, training, all of the things that are on your mind. Come and check it out. Wherever you are in your ransomware preparedness journey, there's going to be something for you in this conversation tomorrow. So be sure that you've marked your calendar and you come back and join us. Again, that's Wednesday, March 22nd, tomorrow. We're going to kick things off a little early. So that's 11 a.m. Eastern, 8 a.m. Pacific, bright and early for you Californians out there. Come join me with a cup of coffee. 11 a.m. Eastern, 8 a.m. Pacific. Tomorrow on the 22nd, we'll be talking the full ransomware spectrum. All right. Well, with that, we'll bring things to a close, and I'll send you on all about your days today. I hope that I get to see you all again tomorrow or Thursday or next week. And until then, I hope you have an absolutely beautiful rest of your day.